Medical debt has become a huge problem in California for people under age 65. People are losing their jobs, they're becoming uninsured, they're facing high deductibles. Even people that have medi-cal, many of their services aren't being covered. And many of the doctors don't even want to take medi-cal patients because they can't afford to treat them.
Yeah, unfortunately, we've linked health insurance to our employment. And what we need is what we were trying to do back in 2009 is to get health insurance that's separate from jobs. Everybody should just have it. It should be universal. Everybody has the right to be taken care of medically if they have a problem. But it's a real problem. And there was a study that was done at the UCLA Center for Health Policy Research, and it showed that medical debt in California is up a lot. 2.6 million people under the age of 65 are covered very poorly, or not covered at all.
What happened to health care reform and the Affordable Health Care Act?
Well, the Affordable Health Care Act didn't include it. I mean, when you have big business like the insurance industry lobbying to try and protect their profits, they'll do anything to keep it private. And the fact that 50 million people in the U.S. don't have any health care insurance and another 50 million are underinsured is a major problem. So the cost of health care has become unaffordable for a lot of people, and the cost of bankruptcy, more often than anything else, is related to medical debt. Even though the medical debt isn't that much these days, it shows, I mean, most people, I'd say 50% of the people in California who have medical debt is less than $2,000. But what that's telling you is that their economic stability of families in California is not very high. And we've got lots of reasons to think that it will get worse until there are more jobs and until we have health insurance that's automatically a right as a citizen.
Well, some people that have medical debt, they end up selling their homes.
Oh, they become destitute, there's no question. So the loss of jobs is a big issue. No insurance and medical debt is something that is ubiquitous now, meaning that pretty much everybody has it.
So what's the solution?
Well, I think we have to change the way we give health care services out. When you look at the $2.5 trillion we spend, that number is so big, it's mind-boggling. And to think that we don't have a mere 100 billion or so of that budget to spend on people who are underinsured is ludicrous thinking. Most people just don't care. Even the medi-cal people are not getting service, or the Medicaid people at the national level are not getting good health care because we've added 32 million people to Medicaid or medi-cal, and we have fewer doctors and we have less money. And we're taking some of the money away from Medicare to try and provide some of those 32 million people with health care, and it just doesn't add up.
It's not going to make any sense.
No, this was predictable back in 2009 when we were talking about how we were going to try and work out insuring more people for a lower cost. That was crazy thinking.
Just moving the money around is...
It's giving less money to more people and thinking that that's a step forward. And
so that's going to translate as less care.
That's right. And, of course, it isn't about health care reform, really. It's about insurance reform. And there's only a little of that that's happened. If you want real health care reform that's affordable, now you have to start talking about lifestyle medicine. It's wellness and prevention. It's looking at diet, exercise, stress, sleep, weight control, and having a purpose in your life. If you will do those things, you won't be talking about medical debt so much because we'll be healthy. And that, of course, is the answer.
That's the way to fight it.
Well, that is the way to fight
Prevention.
it. Well, plus you'll feel better. You'll live longer. You'll have better quality of life. And you won't be spending so darn much money on health care.